Hi, Rich Kaline. How are you?
Good, Jess. How you doing?
I'm doing well, thank you. Hi,
Cha-cha.
Hi, Rich. Hi, Jess.
Hi, how are you?
Good. Rich, it's been so long since I seen you in person.
I know. We got to get together, have lunch or something. I'm coming
Definitely.
out Boston way next week if you want to do it.
Oh, all right. Well, let me see if I'm in Boston, it's like hybrid,
I know. I know. Where are we?
Exactly. I mean, most of the week I'm in Worcester, so.
Well, actually, I'm going to Worcester too. My son lives in Worcester, so I'm going out to visit him.
Awesome. Awesome.
Cool. I'll talk to you. Figure something out.
Yeah, before we invite everyone.
I was gonna say, come on, guys. Where are you going? What kind of cuisine are we looking at here?
Worcester's a hot scene. It's got some good restaurants there.
Yeah, I'm still learning them. So I'm a recent resident now, so I'm still like learning some of the places and little hidden spots people tell you about. So
Where the cool kids go.
yeah, that's me.
All right. We have 22 people who've signed up for today, which is great.
Awesome.
But I would say let's get started so that there's plenty of time for questions and what have you. We'll take a minute just to say hello to everyone. I'm Jess Thompson. I'm the Director of Investor and Community Relations here at the Greater Northampton Chamber of Commerce. This series is called Link and Learn, and Link and Learn is when we look to folks that have expertise that are a part of our community to provide insight and resources to folks that may not have come to whatever situation with that particular expertise. We have a very entrepreneurial community, and so people often come to their work with a lot of passion and experience and insight with the work that they do, but may not know a ton about health insurance or maybe marketing or maybe employee law. So we're lucky to have experts like Rich and like Sharita here with us today. And this, our Link and Learn series is sponsored by Florence Bank. Vince, did you want to say hello or welcome before we dig into the nitty-gritty here?
Let's just dig in and I'll say a few words afterwards.
Okay.
But hello,
great.
everybody.
Hello and welcome, everyone. All right. Sharita, over to you.
Yeah, Rich, would you like to say a little bit beforehand before I get into like the meat and potatoes of the Health Connector for Business and just a little bit about what you're doing with us as a broker?
Sure. So my name is Rich Kaline. I'm a local broker here in Northampton with American Benefits Group, and we use the Health Connector for small business quite a bit. We found a number of advantages or benefits to it that you just can't get anywhere else. Plus, it's a pretty intuitive online experience, so there's not a lot of paper involved, which is nice. So it makes it they try to make it as simple and easy for people to sign up. It's got a lot of variety of the different plans that you can use and different ways that you can offer them to the employees. So there's a number of nice benefits for small businesses, and it can be very small. It can be one employee to up to 50. So that covers about 90% of the businesses, and certainly in Western Massachusetts and across the state. And so take it away.
Thanks, Rich. And Jess, thank you. And Vince, nice to see you. I haven't seen you since
In a year,
pre-COVID.
3 years, yeah.
Yeah, so very nice to see you too also. Again, thank you to the Chamber and thank you to Rich for having the Health Connector for Business come and present during this Link and Learn. I keep wanting to say lunch and learn because it's right around lunch, but your Link and Learn series. I'm the Associate Director for the Health Connector for Business, so I kind of oversee all of the operational and customer service processes. But today, what I'm going to do is kind of give you a high-level overview of what the Health Connector for Business is. Hopefully, it's something that you really see as a great benefit to yourself, your employees. And then, at the end, I'll give you some information on how you can get assistance, which one of the ways is through one of our certified brokers who is on the call with us today, Rich Cahaly. So let me, Jess, I'm going to check and make sure I can share my screen. How's that look? All right, great. All right, so I'm going to go a little bit into Health Connector for Business, which we like to promote as affordable, flexible health coverage for small businesses here in Massachusetts. So we're going to go over what is the Health Connector for Business, what are some of the employers' experiences with our platform through savings, flexible choices, rebates, some of those really great exclusive benefits that you can only get through the Health Connector for Business. And then I'll tell you a little bit about how to go ahead and get started once you hear all of these great options. There's a lot of information in this presentation, and I think the best way to handle questions would be to take them towards the end because I may wind up answering your question during the presentation. So is that okay, Jess? Perfect. All right. So just to give you an overview, who are we? Who is the Health Connector for Business? So just to let you know, we are the state marketplace for small businesses in Massachusetts. So the goal for our platform, I like to call it a platform, it is a marketplace, it's an online marketplace, is to allow for small businesses in Massachusetts with 1 to 50 full-time equivalent employees, the accessibility to shop for plans with the state's leading insurers through exclusive cost saving and flexible choice benefits. So here are all the carriers that are on our platform. Many of these logos may be familiar to you. Some might not because they're not in your area, but I would say the majority of them are familiar to you. They are all the leading insurers in Massachusetts, and they are available on our platform based on where the business is located. So we do surveys every year with brokers, with employers, with employees, and we just really like to find out what is it that is, really some of the great benefits of the Health Connector for Business. And, these are some of the items that we hear back about. Our goal is to maximize accessibility and affordability for small employers in Massachusetts, and we are reaching these goals, and they're through these key points right here. One, as I just discussed before, we have full carrier participation on the Health Connector for Business. We are the state's marketplace that has access to all the leading carriers in one location. So that is an exclusive option that you can only find through the Health Connector for Business. Secondly, with everyone being in one spot, we have found that on average, groups save about 20% before any rebates. So through comparison shopping, groups are actually able to save money because they're able to compare, one plan to another plan all in one spot. And everything is online, like Rich had mentioned, where there's very little paperwork. Actually, we don't promote paperwork at all. That's your choice if you wind up using some paperwork, but our system is completely online. Then there are accessibility to rebates, money back. So we have this great wellness rebate. It's called ConnectWell. It incentivizes employers to promote wellness within their business by giving up to 15% back to employers on what they put employees' premiums during the year if their employees participate in one of the wellness activities. And I'll talk a little bit more about that in the coming slides. We also have this great exclusive option called the employee choice models. It's a way to offer flexible choice to your employees on the plan that they want while keeping your costs constant. And I'm really going to get into how that is exclusive through the Health Connector for Business. We also have certified assistants on the Health Connector for Business. So on the Health Connector for Business, we actually have over 470 certified individual brokers that are free for you to utilize for any Health Connector for Business related item. And they are available for your assistance and they're free to use. Also, just to let you know, any plan that you are purchasing through the Health Connector for Business, you can feel secure that they meet all federal and state coverage requirements and that they meet the minimum credible coverage that is required by the state in order not to receive a tax penalty. So you are offering yourself and your employees coverage that has met the state requirements and been approved by our seal of approval for quality and value. Some plan highlights that we're really happy to point out is we have compatible plans that work with health savings account plans. So if you have a health savings account plan set up with your business also as an extra benefit, there are plans on the Health Connector for Business from each carrier that is compatible with that health savings account plan. So that's an extra benefit for you to offer yourself and your employees. There's also access for out-of-state coverage. The Health Connector for Business asks that carriers offer a PPO plan through our one carrier model, which I will definitely get into in the coming slides. But if you have employees who live well outside the state and they need access to a PPO, you can confirm that you can offer them health coverage, especially in this day and age of a lot of remote work, right? And just again, as I pointed out before, all of the plans on the Health Connector for Business meet the state's minimum credible coverage and have received the Health Connector seal of approval for quality and value. And I'm sure you hear me keep saying, what is, minimum state coverage? Is minimum state the benefits? This is the minimum credible coverage. Plans have to have at least these 10 benefits to be considered meeting minimum credible coverage. All the plans on the Health Connector for Business have these 10 benefits, and some may have even more. So you can feel secure that all the plans you are offering meet the minimum state requirement. So here's a little bit of the details I was talking about. I'm going to go into the employee choice models, the ConnectWell, and the small business healthcare tax credit. So again, just to reiterate, we have found on average that through comparison shopping, because everything is located in one spot on our online platform, businesses can save on average about 20% by shopping through the Health Connector for Business. And that's through comparison shopping. That's being able to quote everything in one spot, take a look at what the business can afford, and then take a look at what might be best for the employees. And through our survey, we have found that these 4 items are some of the top reasons employers utilize the Health Connector for Business. The employee choice models, the ConnectWell rebate, the small business healthcare tax credit, which I hadn't stated before, but the small business healthcare tax credit is a tax credit through the federal government that employers might be eligible for if they shop through the Health Connector for Business. The reason for that is this small business healthcare tax credit is only available to groups that shop on a state marketplace. And since we are the state marketplace, that therefore opens the conversation for you to have with your tax consultant, your tax professional, to see if your group might meet the other requirements. But the key requirement for opening that conversation is I offered health insurance and had my employees enroll through a small business state marketplace, the Health Connector for Business. Then let your tax professional, your accountant start doing all the calculations for the other items. But that is one of our exclusive offerings too. And also to utilize the Health Connector for Business, it does not cost a dime. There's no fees, no membership dues. Again, you can utilize brokers in your community for free for any Health Connector for Business related item. The only thing that you'd have to pay is the premium for the health insurance. So no money to utilize, no fees to utilize the Health Connector for Business. So I've stated the employee choice models several times, and you're probably wondering, what are these? Why are they exclusive to the Health Connector for Business, and why are they such a great benefit? So the goal of the employee choice models, there's 2 goals. One is to allow for the business to control costs, so create a budget. This is what the business can afford, while providing many options to their employees so that employees can go ahead and enroll in the plan that best suits their needs and their family's needs, either financially, health related, benefit related, but the employee gets to choose which plan they want while the business gets to set a budget. And it's very easy for employees to compare plans and look through them because remember, everything's online. So everything's easily accessible to them in one spot. Take a look at benefits, take a look at out-of-pocket costs, take a look at provider network. Everything is very accessible through an online system. Now, the employee choice models, there's 3 different kinds. There's our one plan, our one carrier, and our one level. On this page, I have broken it down really from the health insurance standpoint, but I don't like to go right into like health insurance talk. So instead, I'm going to compare this to pizza first. Okay, just to explain to you what one plan, one carrier, and one level is. I see Vince and Jess smiling. I believe they have heard this great pizza thing. I'm gonna have to change it to like cheesecake soon, but but everyone loves pizza, so that's why we have definitely referred and compared health insurance to pizza. So let me go right into that. All right. How does one plan work? I think someone's microphone is on, so how does one plan work? So imagine you and your employee decide to share the cost of a pizza. Now your employee is going to get this pizza. You're not sharing the pizza. The employee is going to get this pizza, but you have decided to share the cost of a pizza with the employee. Under one plan, you as the decision maker decide that the employee is going to get a $10 pepperoni pizza from the pizzeria down the block. You've chosen that one, and the business is going to pay for half the pizza and the employee is going to pay for the other half, and there you go, the employee gets the pepperoni pizza. So you as the employer have made the decision that it's going to be a pepperoni pizza from the pizzeria down the block. The business is going to pay for half, the employee is going to pay for half, the employee gets the pepperoni pizza. That's how one plan works. So when you think about that in health insurance terms, the decision maker, the business, decides who is going to be the carrier, which plan from that carrier, and how much the business is going to put into it. And then the employees will all have access to that one plan, and they'll either enroll in it because they need health insurance, or they'll waive it because they have health insurance elsewhere. So that's the one plan option. So that's one of the benefits that you can offer. But maybe that doesn't work for your group. Maybe they need something else. So here we have one carrier. How does one carrier work? So this is a little different. As a decision maker, you decide to share the cost of a pizza with your employees. So you tell your employees, you can get a pizza from the pizzeria down the block. So you've chosen the pizzeria. You then look at the menu, you see which one the business could afford, and you say, the $10 pepperoni pizza, that looks good for our budget. We can pay for half of a $10 pepperoni pizza for each employee. So you then say to the employees, you can get a pizza from the pizzeria down the block. We're going to put in for half of the cost of what a pepperoni pizza would be. You can utilize that amount and buy whatever pizza you want, but it has to be from the pizzeria down the block. So one employee might say, you know what, I don't like anything on my pizza. I'm going to get a cheese, and they might buy the cheese, and it might only be, in this case, $8. So you gave them, in this case, $5 towards the pizza. So they only have to pay $3 for their cheese. Maybe you have some employees who are just like, yeah, I'm just going to get the pepperoni. They'll pay the other half. Or maybe you might get some employees who are like, I want a Supreme. So the Supreme pizza might cost $15. You're still only budgeting yourself at the pepperoni pizza, which was $5 share. So the employees who choose the Supreme will pay the other $10. That's how one carrier works. They have to get the pizza from the pizzeria down the block, but they don't have to get the pizza that you said. They just get to utilize the money that you put aside for that pizza. And so when you think about that in carriers, the decision maker will choose what carrier, health insurance plan that they're offering. Then they'll choose a benefit in that plan. to pay into a contribution percentage, and then the employees can choose the benefit that best suits their needs. Maybe you have some employees who need a little bit more coverage than other employees. They might want to buy up to a higher benefit level. Maybe you have some employees who are, no, not a problem, great shape, nothing coming up, no issues, just want to make sure I have coverage. I'm going to keep it kind of simple. I'm going to maybe take, in this case, the silver. I don't know, they will make the decision on what benefit they need for their own selves and their family. And you, as the decision maker, will just pay into the plan that the business can afford. Now, one level is very similar to one carrier, but instead of choosing the carrier, in this case, you're choosing the benefit that you're offering all the employees. So when we think about that from pizza, you're still sharing the cost of a pizza with your employees, but you say to them, hey, I'm going to offer for everyone to get a pepperoni pizza. You've decided it's going to be pepperoni. That was your decision. Everyone's going to get a pepperoni pizza. Then you look at all the menus in the surrounding area and you decide that the pizzeria down the block, their pepperoni pizza, you're going to pay for half of that, the $10 pepperoni pizza. Now, some of your employees might say, I don't like that pizzeria. I don't go there. I'd rather get a pizza from another pizzeria. So they'll go buy that pizza and they'll utilize the amount that you put towards the pizza from that pizzeria down the block. And someone else might say, I'm going over to the one across town, and they'll buy a pizza from there. No matter what, they have to get a pepperoni pizza from one of the available pizzerias. They can utilize the money that you put towards the one that you could afford, but then they will pay the difference outside for the pepperoni pizza from the pizzeria that they bought. And when you think about that for insurance, what you are deciding is what benefit tier you're going to offer for all your employees. You then choose a carrier's plan from that benefit tier to pay into the one that the business can afford. And then the employees can buy across that benefit tier to any carrier and choose the carrier that has their doctors in the network, and then pay the difference outside the one that the business budgeted into. Those are our employee choice models. And again, the goal of that is to allow for an employer to control their costs while providing their employees with the options to enroll in the plan that best suits their needs. Whether that be everyone's fine with the same plan, whether that be people need different benefit options from a carrier that you've chosen, or whether that be everyone's within the same benefit, but they might need different doctors. So they buy across carriers for the network. So another exclusive option is our wellness rebate program, which is called ConnectWell, and it gives the opportunity to get money back for offering health insurance to your employees. And so the way ConnectWell works is if businesses are enrolled on the Health Connector for Business and they have 25 or fewer enrolled employees, they can participate in this ConnectWell program. And the way to participate is they will have their enrolled employees complete one of 30 pre-approved qualifying wellness activities during the benefit year. One of them, there's more than 30 of them. The employees, once they've completed the activity, submitted it, and been approved, will receive a $100 Visa gift card. Once the group has reached 33% participation, approved participation, the group will be eligible to receive back a 15% rebate on what the business put into all the employees' health insurance premiums, not just the 1/3 that took part in it, all the employees' health insurance premium. So this is an actual check back, not money off next year, not a rebate to discount during the year, but at the end of the benefit year, the business will receive a check back for up to 15% of what the group contributed into all the employees' health insurance premiums. And just to let you know, I said there's more than 30 pre-approved wellness activities. They are focused on mind, body, money. We have some at-home activities because we do know a lot of people have adjusted to, doing things from their home. But here's just a sampling of some of those items. Go for massage, go for your well visit, which, you know, if you have health insurance, you definitely utilize for your annual visits. Maybe take a retirement planning course. There's many. This is just a sample. They're very easy touch items that all employees can partake in and complete and submit. And again, everything's online, so there's no paperwork sending back and forth. Everything's just submitted online, approved online, and sent via email, even the gift card. And just to let you know, we definitely help you with this process. We don't just say, oh, you could get back up to 15%. Good luck. No, we actually assist you with getting the employees to participate in this. First of all, you don't have to ask to be enrolled. If the group is eligible, meaning they have 25 or fewer employees enrolled at initial enrollment and they have not received this rebate already 3 times, we auto enroll you. You don't have to ask to be enrolled in the ConnectWell program. We then immediately email both you and the employees to let you know about this great ConnectWell program. We urge the employees to take action and get their $100 Visa reward gift card. Once an employee takes action, uploads their activity online, and it's been approved, we email right away that $100 Visa gift card. So then maybe they start talking to their coworkers, their colleagues, and let them know they got this. Once the group has reached 33% participation, we let them know, and that they will be receiving a rebate at the end of the year. At the end of the year, we contact the business, let them know, and then we compare and make sure everything's correct. And then we send them a nice check for the 15% of the annual premiums. And just to let you know that's true, prior to going remote and going inside, we did do this kind of thing across the state, and we delivered these big checks to people who got ConnectWell rebates. And here's one of them. We really like this quote. We heard that there would be a 15% rebate, and I said, yeah, I'll believe it when I see it, and here it is. So we did deliver this great refund check, this rebate check, and you know, the owner was very happy to get it. And again, she can utilize this money for whatever she'd like. She can put it towards health insurance for the fall next year. She could put it towards something else that the business needs. It is money back for promoting wellness within your business. Now, I just talked about some great stuff. It's, I hope, awesome. I hope it's going to help your business. It is available on the Health Connector for Business. And here are the next steps if you'd like to go ahead and get started with offering your employees in your business health insurance through the Health Connector for Business. So I just want to let you know that a small business in Massachusetts can offer health insurance on the 1st of any month. There's no like close or open enrollment period, such that a lot of people are familiar with for individuals and families who do not have access to health insurance. So for instance, if you hear this great information today and you're like, I want to start my plan on December 1st to my employees, you can go ahead and do that. What you want to do is come to our website, mahealthconnector.org/business. It'll be on our last page, and create an account. Take a look at it. Then within that account, you can shop around. You can hire a broker if you'd like. You can upload your roster. You can, you know, compare rates. But what you want to do is you want to hit a couple of deadlines. So prior to the effective date, the month before, you want to hit a deadline where you open your open enrollment period for your employees by the 10th of the prior month. You pretty much offer the plan. The employees will then all be emailed to let them know that their business is offering them health insurance and that they need to create their own accounts, take a look at the options, and enroll if they need health insurance, or waive if they have health insurance elsewhere. And they need to complete this by the 20th of the prior month. On the 21st, an invoice is generated right in the account. Everything's online. And then an online payment is due no later than the 23rd of the prior month. And that's it. Coverage begins on the 1st. The carriers within the first 10 business days, I believe, send out all the member IDs and everything like that. Invoices are put through every month in the actual portal, and we handle all of those items. Again, I've stated several times that we have the, we have the online self-service model. You can go in, it's pretty easy to do, but we also have the great assistance from our certified brokers in the community that are available to you. I think I've stated several times, they are free for you to utilize for any Health Connector for Business related item. So free to use. Brokers are there. They have accessibility to this great quoting tool where they can compare plan options across the board, put together a nice cost estimate for you, work within your budget, show you what's available. And guess what? They are the subject matter experts on this. They understand health insurance. They understand dental insurance. They understand deductibles, cost sharing, co-pays, all of these items. They are the subject matter experts on this. So they will be able to sit with you, explain the plan options, explain what you're offering to your group, and explain how this fits in your budget, remind you about ConnectWell, remind you about the small business healthcare tax credit, and really help you with the account management of this offering that you're providing for your employees. And again, they're the subject matter expert. They have access to everything. They will save you time so that you can focus on the very, very important things that are within your subject matter expert, and that is your business, so that you can really concentrate on that part, and they'll concentrate on the benefits that you're offering your employees. So, you know, you can definitely do this on your own, but you can definitely utilize the assistance from any of our 470 or more brokers on the Health Connector for Business. And I think I'll go ahead and open it up for questions, however you would like to work that, Jess, or if Vince wants to say anything.
I think that we can just go ahead, and if you would like to ask a question, please unmute yourself, or if for some reason you're not super comfortable, you can also put it in the chat, and I will monitor that to add your question to the conversation. I asked Rich to put his information into the chat so that if you have questions and you would like someone's help walking you through this process, you would know how to get in touch with him.
I have a question. Hi.
Hi.
Hi, I have a question. If I only have one part-time employee, so right now we're doing our healthcare, my husband and I, through the Health Connector, but it's as private citizens. So I have one employee. Would it make sense to like go through the process and to see what this might offer me?
So I heard the key word you said, part-timer. So, so in order to offer health insurance through the Health Connector for Business, you need at least one full-time eligible, full-time equivalent employee to also enroll with you. So for right now, you're doing the right thing by having your health, because you're the owner, right?
Yes.
Yep. So right now, you're definitely going the right route with your individual health insurance until you have that opportunity to switch over to the business, meaning you might have a full-timer who also wants to enroll with you. And just remember, because a small business can start at the beginning of any month, you're not restricted in thinking, oh my God, I'm going to have to wait till my insurance ends to offer the business insurance. You do not. You can start to offer that health insurance, even just for your employee, if you'd like, for the first of any month when you had that full-timer who needs health insurance. And then maybe you, since you already have a plan in place, might want to stay on that individual till your renewal period. Then you'd be able to go ahead and enroll through the business.
And full-time, is that 30 hours or how many hours is considered full? 32?
On 30 hours, 30 hours or more.
Okay, awesome, thank you.
You're welcome. Any others?
Folks were wondering if you would make the slides available. Is that something that we can email to everyone?
Oh, definitely. We'll send you a PDF, Jess.
Okay, great. Rebecca, did you have a question?
Hi, yes. So currently I offer a Health New England plan to my staff, and I don't know, we have about maybe six people participating. If I go on the Health Connector and try to find an equivalent plan, what will it be missing such that that plan can be 20% cheaper?
Rich, would you like to talk a little bit about what you've seen in comparison from going straight to carrier and then maybe offering through us the very similar or the exact plan?
Sure. So Health New England, for an example, has some of the exact plans available through the connector, also available if you're going through direct, Rebecca. It's really just a matter of plan design. So some of the plan designs you can get through the carriers directly have, lower co-pays, lower deductibles. Really, those are the big difference, just the plan designs, whether the, out-of-pocket maximums or the deductibles or the co-pays are greater or lower. But as far as Health New England, for that example, the network's going to be the same. There's still, the minimum coverage is still there. So they're not going to be missing a lot.
And there's the extra additives, if I could just reflect on those, Rich. Now, even if you get the same exact plan through us, you have the accessibility to choose maybe the one carrier, one level, if you want to utilize that. But the ConnectWell, you could participate in that ConnectWell program and possibly get up to 15% back on what you're contributing.
So insurers are just charging more to individual businesses.
No, if it's the same exact plan.
Like, why is it cheaper? There must be fewer services if the plan is cheaper, right?
If it's the same exact plan, it'll be the same exact. It'll be the same exact amount. We don't make the rates or anything like that. That's all done through DOI and approved through Division of Insurance. Mm-hmm. It's the extra things that we are offering that may wind up saving you. So for instance, right now, I don't know how you're offering the health insurance through Health New England, but you might have the option of, working and comparing, and maybe instead you use possibly the one carrier model, right? And instead of paying into whatever plan everyone has, you pay into the plan the business can afford, and everyone can just buy the plan that they need. But the business only responsible for the one they could afford. But if you do buy exactly the same, no difference, right? And, I know Rich has seen this, rates same, everything like that, but then you get to participate in our ConnectWell program. And then you'll get back money for having your employees upload a wellness activity. So there are some ways of getting the savings back. It just depends on the way you shop. So, and again, there are brokers to assist you with that. So there's no difference in again, the carrier, like Rich said, may have some plans that are not on our platform. We understand that. And, but if it's the same exact plan, same exact cost, you'll just be taking advantage of some of those exclusive offerings that may save you money in the long run as the business. And please feel free to jump onto our website, play around with, we have an anonymous browse tool that you could just get a quote if you want. You could throw in your same employees if you want. You could call one of our brokers to compare. Play around with it and see if there is a savings to you. I do know the ConnectWell will definitely be.
Well, I was going to save my testimony to the end, but I think this is a good point in the conversation to share it. Almost 3.5 years ago, I came on as the new executive director here at the Chamber. And one of the first cost savings opportunities was to take a look at our health insurance plan, because it was inching up year after year and the cost was pretty high. And so it's one of the first things I looked at. And we switched to the Health Connector for a couple of reasons. One is when we played around and did the math and crunched the numbers, we saw significant savings. And I can't remember what that was, but it was somewhere between 7 and 14% is what sticks out in my head. And we had 2 equivalent full-time employees and a former employee who was on COBRA who were part of the census to participate in the plan. And what I loved about it is that it was about employer and employee choice. And that made a huge difference for me as a new executive director, trying to, curry favor from my new employees. This was a real win, and we wanted to do business with someone who was more local and who was an investor in the chamber, investor/member. And Rich Kaline fits the bill and has always been a resource that we would refer people to. So it made sense for us to do business with Health Connector. And what I absolutely loved is that every step of the way, it's all about choice. The plan has this minimum requirement, but you can also offer as much generosity to your employees as you like. I discovered that as well. And, the ConnectWell program is incredible. And I don't participate. My spouse is a state employee, so we have great healthcare elsewhere. But again, I just love the fact that the participating employees could choose what worked best for them. And just full disclosure, for 3 years, with just 2 employees, what came back to us was a rebate of $3,800 that we had freedom to use in any way that we wanted. So it's very real and it's quick. And I think, you'll be pleased. I have been extremely satisfied with the plan. And that's my testimony.
Thanks, Vince. And Vince made this great video, which, I think he should share out, where we promoted it on all our social media. But thanks so much, Vince.
Yes. Thank you.
When you send me that PDF, maybe you can send me Vince's video too, so everybody can share.
Definitely.
Sorry about that. Go ahead, Christina.
So I had a question too. So ConnectWell, is that only available for 3 years? I think you mentioned it was available for 3 times.
It's a 3-time payout. So if the group doesn't hit it, so say you were just having a little trouble 1 year and I just couldn't get my employees to participate and it was stressful. We were focused on other things. It's not a like, oh, you missed that year. It's three payouts. So.
Well, one of the things I would love to see for that individual piece where the employee gets a $100 Visa gift card, can we make it a $100 Northampton Chamber gift card?
Well,
look into it, see what you can do.
The reason honestly, I'll be honest with you, the reason we very much focused on the like Visa like gift card was just so that all small, obviously we're working with small businesses, this could be utilized right within small businesses. And we weren't saying, oh, you could go use it with this company or you could go use it with this company. So that was part of our thought process, like, oh, small businesses are getting this back. Let's make sure that we can also use that $100 Visa gift card back possibly to a small business, right? So, but thank you, Vince.
Yep, if you don't ask, you don't get. So still, I think you should look into it because these local businesses will benefit and it keeps the dollars local. And I know it's a lot of probably bureaucracy that you have to go through to do that, but the Commonwealth doesn't play when it comes to health insurance. And I moved here from the state of Texas, and universal health care is a foreign language there. So this is just another affordable option. And again, it's all about choice along the way. So I'm a shameless plug for the Chamber's gift card program, that's all. We're very competitive.
Erin, did you have a question?
Yeah, I don't know if I'm going to be able to put it out clearly, but so when people go as an individual, it's often based on their earnings, how much they make. And it's as a family, often if there's more than one person in the household. So how does that compare? Like if let's say I was an individual and I put in and I made a very low amount, then I would get help paying a bigger chunk of help to pay for it. But if I'm in a group and the employer is choosing something, then my personal like finances of my family isn't put into account, right?
And it's the same. This is employer sponsored coverage. We are just providing you with a one-stop shopping solution to get employer sponsored coverage. So we're not looking at incomes of families, incomes of employees, none of that you're thinking of on the individual side. This is employer sponsored coverage through the Health Connector for Business. It's just set up slightly different than going elsewhere in Massachusetts, and that is pretty much through those exclusive options, such as the employee choice models, such as the ConnectWell program and the small business healthcare tax credit. So it's still employer sponsored coverage. The employer is putting a certain amount into it. The employees are getting a premium back and then paying that through their payroll pre-tax.
And
So
let me-
if you were to compare, if you had this one person who had the family was low income, but they maybe the employee in that family makes an okay amount of money. What's the comparison? I know I'm not saying technical terms.
So if an employer offers health insurance and that is affordable health insurance for their employee, they should take that health insurance. If they were to apply on the individual side, that is actually one of the questions that is, I think, asked right in the beginning of the application. Are you offered coverage by your employer? And they should say yes. And if it is affordable, then they should take your insurance. But on the employer side, the Health Connector for Business, we do not look at anything like income or anything. This is the insurance that you are offering as a business.
So, and just to clarify, there is the potential that it would make more sense for someone to go as an individual to take care of everything individually and not do it through the business.
There could be, but there are some percentages and affordable, and that's not my subject matter expert. So I do apologize. You do not have my colleague on this call, but there are many individuals so on the Health Connector for Business side, we have certified brokers. On the individual and family side, we have certified assisters who work the same as that. Someone should be, sit down with a sister and really, my employer offers health insurance. I think I might be eligible for this, but they have to really look at, does my employer offer affordable coverage? If they do, they should be taking your coverage.
Okay.
Yeah. And that's, they can definitely sit down with one of our assisters and really talk this through, and they will assist them on that side, on the individual family side. And of course, on the business side, a broker will be able to assist you with offering affordable health coverage to your employees.
What is the benefit of doing the one plan? So the one plan is when you choose the pizza and you choose the pizzeria, right?
It's really up to you, honestly.
But that doesn't give your employees
choice, right?
Yeah. Okay.
I see Rich might want to, he works with a lot of groups, so he might want to reflect on how people choose different things.
The advantage there is just the simplicity, Erin. It's one plan. If it works for everybody, great. It's simpler. There's a couple of other factors that go in there, but it's just simplicity. That's what it comes down to.
Great questions, Aaron.
And I think for the chamber, one carrier worked best for us because the employees again got together and decided which plan would work best for them and their care providers and what have you. And the other piece is just downstream, the fact that this is affordable health care. And it's, I don't know what the right language is, sponsored by, endorsed by, owned by the state. All of that.
Offered.
Yeah, offered by the state.
Under our seal of approval.
Seal of approval, yes. Good housekeeping. The fact that it's on your tax form and every tax credit helps. And the fact that, and I don't know what the requirements are if it pans out for individuals, but the fact that it's there and it's I call it a downstream tax credit to the employee, is just, for me, another win for those who participate.
Any other questions? Oh, Erin has another question, I think.
Hi, I don't know if this is gonna be like in your area of where you could answer me, but let's say we're paying our employees a certain salary, but in order for us to be able to start offering health insurance, we're going to need to alter people's salaries to make it lower, because we don't have the extra funds to afford adding healthcare into our budget. Is that making sense?
So that would not be my area of expertise, but
Yeah.
I saw Rich.
But I
come
guess
off.
like if in a small business's realm, that's a possibility, right? That you would, as your employees would have to agree to make less so that everybody can
Right.
health insurance.
There could be some advantages to that, Erin, because when you're providing health insurance to the employees, you can do that on a tax-free basis. So the employees are paying less taxes. They're paying their part of the premium under what's called the Section 125 plan, and that reduces your payroll taxes as well. So it could work and be to everybody's advantage to do it that way. But like you said, you'd have to have an agreement with the employees and everybody signed on to make that work.
Jess, any others? Any in the chat?
No more in the
All right.
chat. Anybody else? We're just, Vince, why don't I kick it to you to wrap it up? And then if anybody else has a, last minute question, throw it in the chat before, because we have 10 minutes left.
Well, I've kind of given my testimony as a witness to the greatness of Health Connector. And I promise everybody here, they didn't pay me to do this. But again, it was a real win for the chamber, and it's very simple. And some parts of it sound too good to be true, but I can attest they are all true. And yeah, so that's really all I have to say. And thanks to everyone for coming, and for everyone involved at the Health Connector to do this for us. We know you guys have been in the marketplace. We're excited about that. You've been making the tour and going around to inform and educate, and that's what we do at the chamber. So this is a natural partnership, and we're just so pleased to be a part of it.
I would also just say, from on a personal level, we reach out to Rich all of the time with questions, and at different with different employers. I've had conversations with other brokers, and I just would like to give Rich a gold star for being understandable and knowledgeable and making it clear to people who don't live in health insurance world all of the time. You don't always know what question you need to ask, but Rich sort of makes that apparent. So he gets a gold star and a halo and all that good stuff. All right.
Thank you, Jess.
Of course, of course. All right, wonderful. It was lovely to see you all here today. I will send out an email. If for some reason you have not, somebody else signed up for you or what have you, and you would like someone to receive the slides, somebody else in your organization, my email address is jessica@northamptonchamber.com, and I would invite you to send me an email just saying please send it to X, Y, or Z, and we'll make sure that you get the follow-up information. We're delighted to have seen you all today, and we hope that you got a lot of your questions answered. Thank you so much, Sharita. Thank you, Rich.
Thank you.
Have a great afternoon, everyone.
See you.